The symptoms of post-traumatic stress disorder, such as guilt, fear, and worry, can feel heavy, like they're weighing you down. If you've lived through a traumatic event like an accident, a disaster, violence, or combat, you may find yourself facing challenges like reliving the event, avoiding reminders of it, feeling down or negative a lot, or feeling on edge or uneasy. But there's good news. There are a variety of PTSD treatments available that have been proven to work and that can help you feel lighter. They can help you learn new ways to manage your feelings, cope with stressful situations, and improve your relationships. Your memory of the event can become less intense, so it won't take up as much space in your mind, and you can focus on the things that matter to you. It's important to know there are many effective ways to treat PTSD. Some people prefer to participate in psychotherapy or talk therapy. Others prefer to take medication, and some people decide to do both. Let's explore some of these treatment options. Talk therapy can be tailored to address how PTSD symptoms show up in your life. The most effective treatment for PTSD is trauma-focused talk therapy. Trauma-focused means that when you talk to your therapist, you focus on your memories of traumatic events and what they mean to you. One-on-one talk therapies include cognitive processing therapy, or CPT, which teaches you new ways to handle upsetting thoughts after trauma. Learning more helpful ways of thinking can have a lasting positive effect on how you feel. Prolonged exposure, or PE, which helps you approach memories and situations you may have been avoiding since the traumatic event. It also allows you to practice more helpful ways of viewing yourself and the world. With time, it gets easier to handle the memories and situations. Eventually, you won't feel like you need to avoid them. Eye movement desensitization and reprocessing, or EMDR, which involves paying attention to a back and forth movement as a way to help you process memories of trauma. Your therapist will also help you identify more helpful thoughts related to the event. These talk therapies usually take 3 to 4 months of weekly visits, and improvements can last long after you've completed therapy. Medication is another effective treatment option. Specifically, a few of the medications known as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, treat PTSD symptoms by adjusting chemicals in the brain that have been affected by trauma. This can help reduce the intensity of PTSD. There are 3 recommended medications: sertraline, known as Zoloft, paroxetine, known as Paxil, and venlafaxine, known as Effexor. These medications must be prescribed by a healthcare provider. They can be effective for as long as you continue to take them as prescribed. It's common to deal with both PTSD and other challenges at the same time. These can include health conditions like chronic pain, depression, substance use problems, traumatic brain injury, or insomnia. Don't let these challenges stop you from pursuing treatment for your PTSD symptoms. Often, effective PTSD treatments can help with these conditions too. Remember, it's never too late to get treatment. Talk to your mental health provider about which treatment options are right for you and your life. Talk therapy, medication, or maybe both. These treatments work, and you can do them in person or by video. Feeling lighter is possible. You deserve this chance to feel better. Use the QR code on the screen or type ptsd.va.gov/decision aid into your browser to access a free online PTSD treatment decision aid, which can help you learn about and compare treatment options. This video was brought to you by the Department of Veterans Affairs, National Center for PTSD.